I thank the gentleman, and now turn and recognize the gentleman from Indiana, Mr. Rokita.
Well, thank you, Chairman. Good morning. Good morning to the witnesses. Appreciate each of you being here. Continuing on this kind of line of thought, I'd like to first turn my attention to Ms. Andrews and Mr. Benjamin. Picking up on liability, has liability concerns overwhelmed your business model? Do you have insurance?
Absolutely, we do have insurance. We have a professional general liability. We have workers' comp insurance.
Right. Has liability been a problem with your business model as you've executed it? The claim here is that there's a concern about liability, that people who are overworked are going to make mistakes and injure your clients. Is that a problem?
That has not been a problem. We don't.
Mr. Benjamin?
It's not a problem. Again, the example that was recently used by Ms. Culp is that if someone breaks their hip and needs help, it's a very different person than someone who was resistant to getting care at home and now has dementia and finally has accepted to create this friend relationship with a live-in caregiver. Those relationships tend to last 4 and 5 and 6 years, which now the companionship exemption, if it goes into effect the way the President wants, would be eliminated. So we have to look at the individual who's getting the care. In terms of liability, there is no liability because individuals who believe that their parents need different shifts request it. I mean, children know their parents best.
Right.
They come to us when they're really sick. We facilitate.
Is your testimony that the Department of Labor activists don't know?
It is my testimony that
don't know their families and the clients as well as their.
They don't know this industry.
Right.
They do not know this industry.
Turning to the turnover, Ms. Culp makes mention in her testimony, both written and verbally, that her business model is superior to each of yours, the way she set it up, and reduces the turnover. Can you speak to turnover in your companies and industry? Is it a problem? Ms. Andrews first.
Turnover certainly across the country is an issue in this industry, but I don't believe that it's related specifically to
hours worked.
Hours worked. I think oftentimes we use employee populations that are professional caregivers, but we also use nursing students. Where I live, we have 4 nursing schools that we draw on for our employees, and so there's an innate turnover with that population as they continue on in a different level of professional care. But our core caregiver groups are very consistent and stay with us. Many have been with me as long as I've owned the agency.
Thank you.
Over 10 years.
Thank you. Mr. Benjamin? Same question.
I deliver a consumer-directed model, which means that the caregiver and the client decide how much they want to pay and whom they want to hire. Our job as a licensed entity is to make sure that their credentials are verified and screened. I have to say the turnover, the way it's set up now, is minimal. It's non-existent because they've chosen their caregiver. They've figured it out. They don't worry about the issue of overtime because they've made the choice. I will tell you, as a person with a disability, people who are disabled, for the most part, find it offensive when an employee-based agency that's normally run by a nurse, I'm a social worker by training, that's normally run by a nurse, tell you how many hours of care you need and how you have to govern your life. I've been disabled a lot longer than a lot of these individuals have been nurses.
Thank you very much. Turning now to the idea of why the Department of Labor has chosen to go down this road. I'm wondering if either of you, Ms. Andrews or Mr. Benjamin, have heard complaints from employees about the hours worked or the wages, or are there shortages? I think this goes to Mr. Klein's, Chairman Klein's question. In your industry, why isn't the free market working? Why isn't free enterprise working here? Why isn't there supply meeting demand as the Department of Labor would have you believe?
Our caregivers are very happy with working their 50 and 60 hours with the same exact individual. Our caregivers are very happy to work in the live-in pool, if you will. It's a different caregiver. You have to understand, as someone who runs a licensed state professional business, I have a pool of caregivers who are live-in and that is how they're distinguished. That is what they want to do. That's how they want to deliver their services. And I have a pool of caregivers that want to work hourly. There are different individuals. In the case that Ms. Culp mentioned earlier, that is an individual who chooses to work hourly, and yes, we figure out a way to have different caregivers.
Do you believe your employees are smart enough to make their own employment decisions?
I believe employees are smart and consumers are smart enough to make their own choices.
My time's expired. I yield to the chairman. Thank you.
I thank the gentleman, and now I recognize my friend from New Jersey, Mr. Andrews.